with knee replacements, this is the specific components that both Dr. Dwyer and Dr. Phelps use in this procedure. It's the Stryker Triathlon Total Knee System. The femur component is made of chrome cobalt. The tibial is also made of chrome cobalt, and then the joint spacer and the back of the patella is polyethylene. And they have very good outcomes with this procedure, or with this prosthesis, lasting 20 to 25 years. And then sometimes Dr. Dwyer uses this prosthetic, the Zimmer Biomet Persona Knee System, but those are the only two components that both Dr. Dwyer and Dr. Phelps use. So during your hospital stay, like I said, the regional nerve block that they perform during your surgery will give you pain relief from typically 24 hours, and then we transition you to oral pain medications using oxycodone and Norco, and we can supplement that as well with ibuprofen or tramadol. And at the time of discharge, you'll be discharged with 3 prescriptions or 4 prescriptions depending on your pain relief needs. And we use our stronger narcotic pain medications as first line, Oxycontin, that's a longer lasting, stronger pain medication that is only prescribed for 2 weeks, and then you'll be weaned off of it with the Norco and ibuprofen and tramadol, and we'll kind of go over that in a later slide. Another prevention that we use in your hospital stay is to prevent blood clots, and the mainstay of the way we do this is getting you out of bed and walking. So after surgery, you'll work with a physical therapist that will walk with you and get you moving, usually with a walker or crutches. After discharge from the hospital, we put you on a blood thinner, and the blood thinner that we use is aspirin, and it's a baby aspirin that's 81 milligrams. You take it twice daily, once in the morning and once at night, for 4 weeks after your surgery. If you take a aspirin already for your medications, then you'll just double the dose for that duration. Another mode that we use to prevent blood clots is SCDs, or sequential compression devices, and these are required for high-risk patients, meaning patients that have had a previous blood clot or have a coagulation disorder that makes them more prone to having blood clots, or if they cannot take aspirin for whatever reason. These are required. We also recommend these for all patients. These are devices that are fitted to your lower legs that squeeze your calves in a sequential fashion to promote blood flow back into your heart. Unfortunately, these are not covered by insurance, but we sell them in our office, and we can provide you more information about getting those beforehand. And the cost that we have them for is $225. And like I mentioned before, during your hospital stay, you'll be working with physical therapists, and the day of your surgery, a couple hours after you're out of recovery, you'll get working with a physical therapist to get you out of bed and start walking with most likely a walker. Then you'll be discharged with a walker, and after your discharge, you'll be working with a physical therapist at your home for approximately 3 weeks, and then after that, you'll transition to an outpatient therapy program for approximately 10 weeks, and then during the duration that you're not in working with a physical therapist, they'll give you a home exercise program to do on those days you're not in physical therapy. And so now we'll talk more about the specifics on what to expect after your knee replacement. There's 3 main components that we aim to fix with the knee replacement, and this is what you can expect afterwards. First is improvement in pain. Knee replacements will improve approximately 90 to 98% of pain afterwards, especially with the arthritis that you're experiencing. We remove the arthritic bone, and so you're not having bone-on-bone contact, which is what is causing the pain. You may have some residual pain afterwards that could be related to activity or use, but it shouldn't be the constant pain that you're having now. And then improvement in function, being able to do more of what you want to do, being able to bend your knee as much as you can. Afterwards, being able to walk more and do the activities that you desire. And then correction of deformities. So this is improvement in range of motion and correction of any varus, which is bow-leggedness that could have occurred as a result of the arthritis in your knee. General considerations to taking effect after surgery, especially within the first 4 weeks. You're going to have a surgical incision on the front portion of your knee that will be closed with sutures that are absorbable, and so there's no need to have stitches removed. Then you'll have a dressing that's placed over it that is water resistant. During the first 2 weeks, you will keep this dressing dry and clean until you follow up with us in our office. At that time, we'll remove that dressing, and you'll have the only thing that will be covering your knee is this mesh, super glue mesh that will slowly peel off over time. At 2 weeks, you'll be able to shower and pat dry, run water over the area, leave the incision open the area. There's no need to cover it or put any medications on it. And then you'll avoid using lotions or any scar creams for the first 4 weeks, as well as submerging in baths or swimming pools or hot tubs as well for the first 4 weeks while that skin incision heals. Also, for your post-operative management, we put you on different pain medications, as I mentioned before, and this is just an example of how you can break up your pain medications to make sure that you have adequate pain control throughout the day. And so using your stronger pain medications like Oxycontin in the morning and at night, that will help you get throughout the day as well as get through sleeping, and then supplementing Norco or Tramadol throughout the day for breakthrough pain. And then the ibuprofen can be taken scheduled throughout the day for the anti-inflammatory effect. But this is just an example. You may have to talk with your doctor specifically if you're already on pain medications or if you have any allergies, and we can work with you on an individual basis to meet your pain management needs. And an easy way to organize your pain medications is using one of these pill boxes. That way you can keep track of your morning, afternoon, and night pain medications. And like I said before, physical therapy, you'll be in physical therapy, home physical therapy for the first 3 weeks after surgery. They'll work with you on getting back general range of motion as well as starting to walk. And then after that, we'll assess how you've done with home physical therapy and just transition you to outpatient therapy twice a week for additional 10 weeks. And the 3 mainstays that they do is focus on walking, improving range of motion, and quad strengthening. And some of the strengthening programs they use later on, obviously walking, any water therapy, and stationary biking. You won't be able to do any high impact activities after surgery, such as running or jogging or jumping, because these can degrade that plastic liner more quickly than it's intended to, and you'll have that'll may lead to another surgery in the future. And your activity, you can resume to driving whenever you can bend your knee enough where you can comfortably enter and sit into the car. Typically, we assess disability at 2 to 3 weeks during your first post-op visit, and depending on it, whether it's your right knee or left knee, or the type of car you drive, probably won't return to driving until 4 to 6 weeks after surgery. And driving is not recommended and advised against when you are on any narcotic pain medications, as these pain medications can make you drowsy and sleepy. And you'll be using a walker right after surgery, probably the first 2 weeks, and then transitioning to a cane for the next 2 weeks. You'll probably be off any sort of ambulatory assistive device in the 4 to 6 week period. And this is just a chart of your expected milestones in terms of what it looks like from day 1 to about a year out from surgery. And so, as you can see, you'll slowly get to increase in your knee flexion, and you'll have full extension of your knee. And really about the 3 month, you'll be completed that outpatient physical therapy. They'll have you on that home exercise program. Your knee flexion will continue to improve. About 6 months out, you'll be walking and doing normal activity as you can tolerate. And then about a 1 year mark is when it's going to be as good as it's going to get. And so we really work with you in the first couple weeks to a month to make sure that the physical therapy is going as planned to get you back to your normal function. And then we want to avoid infections after surgery, and predominantly this includes infections that could happen as a result of any dental work. So during any dental work, the bacteria in your mouth, there's a low probability, but a chance that those bacteria could enter into your bloodstream and travel to your joint that you had replaced. And so to combat that, we give antibiotics before any dental work, and these can be done by giving our office a call and saying whatever procedure you're having done, and we can send in a prescription. But this is indicated for any dental cleanings, any sort of dental surgeries or procedures. In terms of when you can have dental procedures done after your knee replacement, it's a minimum of 6 months. And so if you need those cleanings or anything done, it's recommended that you have those done before your surgery to not delay anything further. And then we already talked about blood clot prevention, but this is essential, especially in the 4 weeks, but can continue, the risk could continue afterwards. And so walking and being active are your main ways to prevent blood clots. If you're also at home and sitting watching TV or something, doing foot and ankle exercises to squeeze your calves to promote that blood flow can also be done. And then the other thing is, like, compression socks will be given after your discharge that can help with swelling as well and allow blood flow back into your heart to help promote that. And lastly, if you're experiencing any of these signs, these are indications to go notify our office and go to the emergency room. So first, of an infection, if you're having any persistent fever or chills, if there's any increased redness around the surgical site on the knee, if you have any drainage from the knee, and longer term, if you're having any pain with in your knee with both activity and rest, that could be indicating a joint infection and would need further evaluation. For looking for signs of a blood clot, if you have any increased pain or tenderness in your calf, any swelling, those are signs of a deep vein thrombosis or blood clot in your leg that would need further evaluation. Or if you have sudden shortness of breath, sudden onset of chest pain, or localized chest pain with coughing, these are signs of a pulmonary embolism or blood clot in your lung that would warrant a visit to the emergency room for evaluation. And that's all that I have for this presentation. If you have any questions, you can give our office a call. Our number is there. It's 210-545-7171, or visit our website. We'd be more than happy to talk with you. Thank you for listening to this presentation, and we'll see you for your surgery.